to make sure you, because we're going to add vessels, right? And all kinds of stuff today to the basics. So there you go.
That's great.
Yeah.
That's awesome. Where did you find that?
You know, I found it in Canvas.
What?
Or in Canva, yeah.
Oh,
So I had to find the video, yeah. So you guys won't have it because it's a PDF only, but if you want this, I also found a couple other websites for you. Yeah. So yeah. Okay, so liver anatomy. We talked about this last week. Again, I don't know how much you guys actually remembered from last week. Or Tommy, what used to be our lights guy. Sorry, Tom.
Take my job too.
So last week we talked about liver anatomy. We talked about the anatomical variance location, the different lobes it has, ligaments and fissures. We started talking about hepatic veins, portal veins, and then we tried to get to portal veins, but we didn't. So we're gonna just review, and then I'm gonna walk you guys through these, and then we will go on to the gallbladder and the pancreas. So anatomic variances. Anybody remember? Really, there's only two anatomic variances.
Rydell's, is it?
Rydell's lobe, and that is where the right lobe has grown inferiorly. Right, so it's just like an extra lobe. And sometimes, you know, and it doesn't matter. They don't really care because it doesn't do anything. It's just extra liver tissue, right? But it can go all the ways down to that crust. What's the other one? Does anybody remember? The Hoover cell. Yeah. And that's one where it goes over towards that spleen. The left side just kind of grows a little bit longer. And again, doesn't have any effect. They're just anatomic variants. But things you'll need to know on ultrasound or for your boards, because you will get those questions. Whether you get an image or whether they do a definition. So we talked about it being the largest organ in the body, right? Right lobe, you've got your Beaver's tail and your Rydell's lobe. Here's your Rydell's lobe. This is what it looks like at CT, right? Kind of gives you a really good idea. And this is what it's going to look like in ultrasound. And sometimes it's like, is that a fatty liver or is that a Rydell's lobe? Doesn't really matter. They don't care. So you don't even have to mention it. Where they care, the boards. This is your beaver tail. I couldn't really find any good ultrasound images. They most likely won't even give you an image unless it's CT. But you definitely will probably get either this or this on your boards. Okay? So know those. And then we also talked about the liver location, located in the right upper quadrant, as you guys know, inferior to that right diaphragm and hemidiaphragm, and then superior to the right kidney and right hepatic flexure of the large intestine. That is going to be this area right here. So, right where your colon is going up, and then here, it's that corner. So that's all that's saying. Anterior to the aorta and the IVC, of course, you need to know that. That's layering, right? Very, very important that you know that. Okay, and as a visual for you guys, kind of your 3D a little bit for you here, Connor. This is your diaphragm, right? And so if we tuck that liver right into that pocket, we can already tell that the right lobe, we're going to see a little bit here anteriorly, but we're going to see a lot posterior, right? And we'll see some superiorly. And you guys will see that on ultrasound because it's very echogenic, okay? And fluid, if fluid is in the lungs, you're going to see it between here. If there's fluid in the stomach, like ascites, which you guys will learn later, that's going to be stuck here and here. So that's kind of your border for that. And you guys will learn that eventually in your other class. So here's a nice little 3D cut for you guys of really where's the transducer going in cross-sectional here, right? And really scanning that liver. This is the stomach. Realizing here's your aorta, right? So it's very posterior. And so remember, if this was the scan that we're taking, this is the image you would see, right? So if you guys can put your transducer, we're anterior going posterior. We're in a sag position, so where is the left side of the image? Superior, right? Inferior. Yeah. Hard to wrap your head around that concept, you guys. It's only your third week. Don't freak out. You'll eventually get it.
I'm sorry, where did this part come from?
It got sent an email. I think you missed class last week.
Gotcha.
Yeah. Speaking of that, by the way, guys, this class, if you do miss it, it is 5 points. If you miss this class, which is a big deal on your grade, because it's like 225 points total for your grade for this class, and so make sure that you guys are here participating, doing your stuff. As long as you're participating, we're having fun, and you guys are learning. Cool. Other than that, I'm not gonna mark you guys down on anything. I want you guys to be successful. So make sure you're here. Liver location again sits anterior to the aorta and IVC. Probably sounds repetitive and being silly right now to say it, but you're gonna need to know that for everything. Okay, the lobes. There's 4 lobes. Is anyone brave enough to tell me what the 4 lobes are? Besides Connor. Haley.
The right lobe, the left lobe, caudate lobe, and the quadrate.
Yes, good job. Yes, so you've got the right lobe, which is the largest, right? Then the left lobe is just a tiny little baby lobe, right? But even smaller on the posterior aspect is your caudate lobe and the quadrate. Do we see the quadrate at all on ultrasound? No. So do we really care about it? No. It's just something you need to know that exists for your course. And maybe a test, I don't know. But the caudate lobe is what we see all the time when we're scanning people. We're going to see the left lobe, we're going to see some kind of fissure, and then we're going to see the caudate lobe. Does anybody remember the fissure that we see in between the left lobe of the liver and the caudate? I'm looking at Bree, because she should know this.
Ligamentum venosum.
Yes, ligamentum venosum. Yes, good job. Yep, perfect. And as you guys know, the falciform ligament, I drew it in my little picture here. Falciform ligament, and it divides the right lobe and the left lobe. So remember that. And I think that's pretty good. Yeah, we got it all. And remember, anterior is the right and left side, right? But posterior is where you're going to find the caudate lobe and the quadrate. And here they are. So you'll see left lobe, fissure, caudate lobe, IVC, right lobe. And then we're going to talk about this today. We're going to add this to your liver stuff. All right, and here's your image. Your left liver lobe, then your caudate lobe, your IVC, and again, Bree, what's this ligament here? Yeah, ligamentum venosum. You guys are gonna take this picture image over and over and over and over and over and over and over. So make sure you know how to label it, because Shay will ask you over and over and over. This is not her favorite. This is like her second favorite image. Yeah.
So venous ligament, same thing.
Yes, ligamentum venosum, and if you're in a different country, we call it that. Around here, we call it ligamentum venosum. But yeah, they call it all kinds of different things. Okay, so your quadrate lobe is posterior. We don't use it. All right, liver basics. Again, here's your falciform ligament. Make sure you guys know that that is anterior. And we're not really it's not something we look for or look at in ultrasound. You just need to know that it's there. It divides the right from the left. This is where you will see it. This is a serotic liver. Did you guys cover that today finally? Yeah. So this is a serotic liver, and you can see the fissure right here. the right from the left lobe of the liver. So if you're a radiologist and you're trying to decide how bad is this pathology, how bad is this cirrhotic liver, and you see all that dark stuff around it, what do you guys think that is? Fluid. That's the ascites I was talking about. And we drain them. As ultrasound techs, we work with IRs, which are interventional radiologists, and we help them drain that fluid because we guide it through ultrasound. All right, liver bases again, ligaments and fissures. Again, you guys should know all of these. The coronary ligament we don't really use, but again, you need to know that it exists. Coronary, it means crown, by the way. That's what the term means. And so crown is usually, if you wear a crown, it's a hat, it's top, right? So it's just the top. There's a left and there's a right. Again, you're not going to see it, you're not going to use it, but you need to know the information. Okay. Ligamentum venosum, though, you definitely need to know that because you're going to see that all the time. And then the round ligament. The round ligament is actually called ligamentum teres, or the teres ligament. So we talked about this last week. They're interchangeable. So whether they say round or teres, and we're going to talk about this one later today because you will see this when you're scanning the left liver lobe. But it's going to look like a triangle, or sometimes like a diamond, depending on. And so don't get that confused with the ligamentum venosum. The teres is like a little diamond or a triangle, and the other ligament we're going to see in long, the venosum. So we'll see that long. Okay, and there it is on this image. Ligamentum venosum.
Excuse me.
See it right there. Long. They're going to appear echogenic. Remember that. All fissures and ligaments are echogenic.
Ligamentum Arteries that we're going to see like a diamond, we're going to see in cross section.
Yeah. And again, that's not really a ligament that anybody needs to see or that we can see. It doesn't really doesn't do anything, right? But it's just good to know what you're looking at. If your CI is like trying to trick you when you're in clinicals, because I had this happen, they're like, "What is that?" And I was like, "It's the ligamentum teres." Hello, right? So yeah, just outsmart them. And okay, main lobar fissure. We talked about this one last week as well. One of the main dividers of the liver into fairly equal right and left lobes. And seen as a white line extending from the portal hepatis to the gallbladder neck. We're really going to cover the gallbladder today, so this will all come together for you guys. But it is this little echogenic line right here, main lobar fissure. And gallbladder is here, portal vein is here, the common bile duct is here, okay? And this is the left lobe going into the right lobe here in this image. Yes, Connor?
I'm a little confused with the falciform ligament because I've seen two different types of definitions for it. One where it says that it divides the right and the left lobe, and then another like what this diagram shows where it divides the left lobe into the medial and lateral segments.
So it actually is dividing. This is all the right lobe here, and this is the left lobe. So it is dividing the right to the left. And you guys, you're gonna have a ton of board questions that ask you what divides the liver from right to left. And you're gonna take all of the things, and we talked about this last week. I'll help you guys compile them together, because of course I already did that, right? And that way you know what does, right? And then what breaks the liver into medial and lateral, what the right side does, anterior and posterior. Yeah, we'll cover that. So here again are just images. Here's your ligamentum teres. You see how it's kind of like just this little tiny diamond. When you're live, it looks like a diamond. Sometimes it's just like a little triangle. But that's all. Nothing exciting. Yeah. So when you guys are scanning in your lab and your free time, kind of look and go, okay, can I find these ligaments that we talked about? And it makes it fun. Main lobar fissure definitely is going to come up a lot because we use that for a lot of different landmarks. Vasculature. Okay, we talked about this. artery. How much, how much of the blood flow comes from the hepatic artery?
A little.
Just a little.
How much?
A little.
A little, like 20%. Small amount coming straight from the heart, right? Freshly oxygenated. Where are we getting most of the blood supply from the liver? Portal vein. Weird, right? Because it's a vein. It's the one weird vein. But we get about 80% of the oxygen and nutrients. Because it's coming from the stomach, it's going to carry all those vitamins and nutrients, but it's also going to carry all this stuff like prescription pills, things like that, right? So the liver works super hard, and therefore there's a lot of pathology, and it can be overwhelming because the liver does a lot of different things. So it'll all come together for you guys. So, and of course the hepatic veins, they're kind of like little straws at the top, like a little claw. They're smaller down here, and they're larger up here because we're draining the liver, right? And it's feeding the IVC, and the IVC is going directly where?
Right there.
The right atrium. Exactly. See, I've got this. This is great. So going in, and yeah, you guys can do your gangster signs, right? I believe it is this, and then this. Something like that.
She only did it for the portal.
Oh, she just did it for the portal? Your anterior, posterior portals flowing this way. So remember, your hepatics are going to flow in a sagittal, right? They're going up and down, typically going up, right? And your portals are going transversely through the body. Very important for you to know. I believe she's going to ask you this over and over again. Boards will ask you this. What is the difference between the hepatic and the portal veins on a sonographic view?
Yes.
Yes, portal veins have bright echogenic walls. Can anybody tell me why they do and the hepatics don't? Yes. They basically, because it is supplying most of all that nutrition and oxygen, they have to be stronger, and so they have to have more fiber and the fibers and the layers. So they're just stronger and meatier is what I like to think of them, right? Whereas, the hepatic veins, they're just draining. They're just like, let me put my straw in the liver here. All right. They don't have to work that hard, but the portals do. So they're going to have echogenic walls versus none. All right. So in more depth, what we talked about, hepatic veins drain into the IVC, and the portal veins feed the liver. So both of them are going up. Okay. Great image. And they have to draw it eventually. Hepatic veins. Blood vessels that return low oxygen blood from the liver back to the heart. There's 3 of them. Can you guys, anybody remember what they are called? Anybody want to volunteer? Right, middle, left. Beck, you got the easy question for the day. Good job. Yes, right, middle, left. So you've got your left, you got your middle. The middle one, by the way, also divides the liver from right to left as well. So there's a long list of different things. You've got fissures, you've got veins, you've got arteries, all different types of things. We put it all together at the end. And something you guys don't need to memorize now, but you'll know for physics, so I put it in here, is that they are triphasic. The reason they're triphasic is because they're so close to the heart, right? You get the lump, thump, lump, thump. So you're going to get a very, 3 different ways, basically. So it's going to go below, up. But again, a little bit advanced for you guys. Yes.
And that's talking about towards the heart and then away from the heart, hepatopedal.
That's different, yes.
But
And
But
that,
towards
yes.
the heart, away from the heart, that same
Yeah.
towards the motion.
We use that term usually for the main portal vein. Yeah. All right. Oh, middle hepatic vein separates the right lobe from the left. All right. Really quick, I want you guys to grab a piece of paper. I want you to draw your liver, and I want you to draw your fissure, your falciform ligament. Sorry, I mean to be more specific. There's several of them. Yes, I saw that, and I was like, oh yeah. Which one? want you to put your 3 hepatic veins, I want you to label them as well. So if you're drawing a hepatic vein and it feeds the middle of the liver, it should be somewhere close to your ligament, the falciform ligament, right? So, I mean, I tried to draw it. So you got your falciform ligament. Now I want you to label your right and your left side, and then label each one of your vessels. This is going to help you greatly as we layer today onto everything. Yeah, what was so quietly? Yes. So draw the liver, and then I want you to draw your 3 hepatic veins, and I want you to label. I also want you to add your falciform ligament. So label the right and the left. Raise your hand if you have any questions, concerns.
If we draw falciform ligament, it's mean we make anterior view.
Yes. Remember that falciform ligament is holding the liver anteriorly, right? That's the question you're going to get if you get anything about the falciform. It's either that or that it divides the liver from right to left. It's kind of right in the middle. Yeah. It's tricky. You don't have to draw the IVC today with your liver because that gets way too confusing unless you're a great artist. So I just want you to put in your hepatics where they need to be and label them. All right. Here is what they look like on ultrasound. They're so cute. Looks like kind of a reindeer, a deer. You'll get the Playboy bunny a lot. So that's kind of what we nickname all of them. And you're not always going to get all 3 on some people. You may only end up getting 1 or 2. If you get all 3, you've got a really good scan.
We are standing transverse and a little bit to our right. Is it true? Transverse, yes. Pretty high.
So when I am scanning, I do my transverse, or I do my left lobe of the liver. I go sag, 1, 2, 3, and then a transverse, 1, 2, 3. You guys will learn that in lab. And then, right before I go to the right, that's where I do my hepatics, because it's right in the middle, and I do it in transverse. And I just go, kind of move my probe a little bit up, and then boom, you'll get this beautiful image.
Mm-hmm.
So practice. And most of you guys have little glass bodies, so it's going to be easy to scan and get these. Build your confidence before you get to the real population. All right. Main portal vein enters the liver at the porta hepatis. Can anybody tell me what that is besides Connor? What is the porta hepatis? It's a part of the liver, yeah. It's kind of like what we call the hilum. Just like the kidney, we call it a hilum, where the vessels are entering. Same thing here, it's where the vessels are going to be entering into that liver. Okay? And also known as the liver hilum. Main portal vein is created by the union of the
Splenic vein.
Yes. So the splenic vein and the SMV. Now remember, the splenic vein was the female in our marriage, right? You remember this? Splenic vein was the woman. And along the way to meet Mr. Right, who is the SMV, she picked up her child, which is the IMV. And then they got married. And then their name changed to what?
Portal.
The main portal vein.
It's such a happy marriage.
It is a very happy marriage. This is how I remembered it, okay? I had to do silly things to help me. And whatever it takes. And some of you are already vessel that a marriage happened. Yes. And so the merge of these vessels as well as I and B referred to as a portal splenic confluence. Portal splenic confluence. As the main portal vein enters the liver, it splits into right and left. Okay? We're going to draw these soon, but I'm going to give you images first. The right portal vein is separated into anterior and posterior. So this is the right, it's going to go here, and boom. Anterior, posterior. So it's going to go this way. Still going transverse though, right? Into the liver. And the left portal vein is separated into medial and lateral. Yeah, so you've got this one going here, this one going here, and this one goes boom. So let's think about this really quick. Lateral and medial on the left lobe. Does that make sense? Because there's a lot of vessels that do the same thing. They go lateral and medial. Because you've got your liver here. It's coming in here. We need it to feed the lateral aspect of the left lobe. We also need it to feed the medial aspect here. And so the right one is just going to take care of the anterior posterior sections. So that's why one goes one way and the other goes the other way. Liver, the left liver lobe's not really big enough for it to go anterior posterior. But the right, yeah, there's a lot there. Okay, the measurement at the main portal vein can vary, but should always measure less than 13 millimeters. Otherwise, and that's an AP diameter. Does anybody remember what AP diameter means?
Anterior, posterior.
Anterior, posterior, yeah. So most likely this is going to be a sagittal measurement. You can also do it in transverse as well. But transverse, if you do transverse, is your measurement going to be this way and this way, or is it this way and this way? Yeah, anterior, posterior. Because your probe is touching anteriorly. Took me forever to understand that concept. That's why I'm like drilling it in, right? You're touching anteriorly, and so you want to measure anterior to posterior.
So even if we're in a transverse scan window on the main portal vein, you'll still take an anterior posterior measurement.
And for the volume, we're going to go both ways, and then a third way in sag. And sag is always going to be what we consider A and P as well, but really, there's no A and P in sag, right?
About measuring the size, is it just intima to intima or adventitia to adventitia?
And you're going to outside. Vessels are always going to be the outside. That echogenic part is where we measure. And so you're going to measure outer to outer.
Outer to outer.
Yeah. And don't worry about that. That's another class, you guys. Don't let it get you confused. So the measurement, the reason why we need to know this is because they could have portal hypertension. And this is where the normal flow is hepatopedal, and that's what it should be, versus, what's the other? Hepatofugal. We talked about this last week. Do you guys remember? One is you're swimming in. Hepatopedal, you're like pedaling in, right? You're doing a boat. I always just think you're on water, right? You're paddling in. You're going in. And fungus, right? I always say hepatofugal is like fugitive, you're running away from, or fungi, you're running away from. So that's going away from where it should be. That's how I remember it. I don't know. Crazy stuff, right? If only you had me last year. So hepatopedal and hepatoportal, you'll learn on another class. I don't expect you guys to know that. It's just, again, information to tie it all in together so you have it in one place. Okay, this is what it looks like. Let's talk about the marriage here. And what's the girl's name again?
Splenic.
Splenic vein. Who's she married?
Splenic.
Right, that's right.
Mr. Right. Mr. SMV. Superior mesenteric vein. And they join right here. But on her way, she picks up your little kiddo, the IMV.
George would not
And then
approve
they get
it.
married, and they change their name, and now they're called the main portal vein. Yes.
Is the portal confluence extrahepatic or intrahepatic?
Oh, good questions, good questions, good questions. So the main portal vein is going to be intra, this is going in there, and the rest are extrahepatic. Yes. Very good question. So, what I'm going to have you guys do is draw this. We're going to add this, and here is what it also looks like going into the liver. So your portal veins. So we're just going to have you add this little drawing. You're going to draw and label your, now you can add a spleen, draw your vein, your misses, and then your IME, and then the marriage. And you can kind of see that all of this stuff is extrahepatic here. And the portal vein, it turns into the portal vein right as it enters.
Is it correct to say the main portal vein is only IMV and SMV?
Main portal vein is just the union of all those vessels coming together, right?
So if I say three of them is still correct?
We call it MPV, main portal vein. That's how everybody knows it. Because we're gonna be measuring and putting Doppler on the main portal vein to make sure it's going, the flow's going the right way. So I would just train your brain right now for main portal vein. The confluence is the joint, the union. And you will see that today, later, when we talk about the pancreas. Because you're going to kind of see it happen. So for now, though, just draw in your main portal vein going in, going to the left, and the left is divided into lateral and medial. And your right is divided how?
Anterior.
Anterior, posterior. You got it.
I've heard that main portal vein, like always perpendicular to IVC. Is it true?
I'm sorry, I don't understand your question.
Perpendicular if it's angle 90% between portal vein and IVC.
Yes,
Uh-huh.
yes. We don't need to know that.
Mm-hmm.
I'm
Just to
sure-
understand.
I'm sure as a nurse, you guys had to like know the angles and stuff. We just pop color on and go, yep, there's the main portal vein.
Just to understand.
All right. How are we doing on our stuff? Okay. Hepatic artery. This is only 20%, right? It's coming straight off the aorta. What is the hepatic artery? Where's the origin? Where is it coming off of it? Because it's not directly off the aorta.
Sailor.
There you go, your celiac trunk. That is the origin. And then the origin for the celiac trunk would be the aorta. Good. So, the common hepatic artery, some people call it the proper hepatic artery, and some people just call it the hepatic artery. I like to simplify things. I call it the hepatic artery. Okay? However you label it, just know that people call it different things. Again, just trying to confuse you. And it branches into the right and left, which makes sense. And common hepatic artery can be seen at the portal hepatis, but the right and left branches cannot be seen by ultrasound unless they are abnormal. So you're only going to see it at basically at the portal confluence, which we're going to talk about here next. But the hepatic artery is feeding the liver, right? So it's going up and in. stabilize the flow. I won't have you guys have this quite yet unless you're already doing it. Because we're going to talk about a couple other things. Let's talk about the common bile duct, which we're going to go into more detail today. And the common bile duct is the duct that we will see on ultrasound. We're going to see it right here as it enters into the liver. So this is going to be your portal vein here, or your main portal vein. This is your hepatic artery, and this is your common bile duct. You guys will know this by the time we're done with class today. We'll have it down. Now what I do want you to draw though is your little fun branch. This is the bile duct and how it works. It goes from right to left. Because it is flowing down, right? You've got the hepatic artery flowing up into the liver. You've got the main portal vein flowing up into the liver. This one is a little tricky because the bile is coming out of the liver. Because bile is made in the liver, right? I think you're learning that in Ray's class, and you probably already learned it in anatomy. So it's coming down. And so we start with the right and left instead of starting at the ampulla because it's coming down. So we've got the two branches, the right and left branch, and then forms the common hepatic. Right off of that, you're going to see a cystic duct, and that pulls the gallbladder. The gallbladder, when you eat, is going to squeeze, and it's going to push stuff out into the common bile duct. That is the part of the duct that we see and that we're looking for. If you can see the right hepatic and the left hepatic, they've got some kind of biliary disease. We should not see that. Okay? And you never want to scan we have a student right now who was stuck scanning inside the liver for the common bile duct. But it's not really the common bile duct. It's either the right or the left, and they're usually super tiny, right? And so you want to be extra hepatic, which is where your common bile duct is, okay? That's what we will be measuring. And you'll learn that in another class. So then it comes down, and it feeds into the duodenum, the second portion of the duodenum, because it's going to meet up with this pancreatic duct right here. The pancreatic duct is giving off fluids too, right? And all kinds of enzymes and things like that. And so they kind of anestimate here, unionize, right? And that comes down in here, and then all those juices get squirt right out into that duodenum. And so now we can break up fat. Now we can break up, we have all the enzymes to break up carbs and sugars and all that kind of stuff, right? And so right, left, that's the gallbladder. We'll cover this again today and then the next lecture. Oh, here's all three together. This is where I was like, okay, put them together now. Okay? This is your portal triad, is what we call it. It's got your common bile duct, your hepatic artery, and your portal vein. Remember, two are going in the liver, one is going out the liver. So put your little arrows in your drawing. So, and the portal triad, if, for those of you who are A-type like me, and you just must know, it is located in the medial aspect of the right liver lobe. It's coming in the posterior aspect of the medial. It's kind of like, it's more posterior than interior, but we can see it on ultrasound. So, but it's that surface of the liver that is coming into. I don't remember being asked any tricky questions about that, like medial right liver lobe. Nobody cares. Yeah. But if you did care, all right, here it is again. If we're slicing it, this is all new information now for you guys, right? This is where you guys were giving me the deer in the headlight, and I was like, okay, we're done. You guys can't take anymore. So the portal triad consists of your main portal vein, your common hepatic, and the hepatic artery. Common hepatic, bile duct, by the way. CBD. Common. Common bile ducts, portal vein, hepatic artery. As you can see on this image right here, it's color coded for you. So this is a transverse, because we're cutting it transversely, right? And so here's how I remembered it. You've got your Mickey Mouse ears, right? And it goes, I believe I said this to you guys. Don't remember if anybody was coherent at that time, but I used the alphabet. So anytime when I was new and I was in my clinical rotation and I was like, oh my God, I have no idea what's what, and I need to turn and get the common bile duct, what if I accidentally get the hepatic artery? Well, if I can find the Mickey Mouse ears, I know that C comes before H and H comes before P. So I always know it's going to be CHP. And so then I can turn on that, the first ear. Right? There's your Mickey Mouse. This is a transverse image. See how much bigger that portal vein is, you guys? It's huge.
Is that a regular size portal?
Oh yeah, yeah. It should literally look like Mickey Mouse head. When you find that, you know, you're like, I'm getting good at scanning. I just got the portal triad. Yeah.
What is a big black
Yeah.
thing?
What is it? Oh, great question. That is a gallbladder.
That's it.
That is a gallbladders fold sometimes. They look weird sometimes. And you guys will learn that in Rain's class if you haven't already. The gallbladders, yeah, can look really crazy sometimes. And in gallbladders, we're going to talk today, but this is where we're worried. We're worried about something getting stuck here in the neck, because then you can't squirt bile out, and then guess what? It just backs up, right? And then just sits there. And anything that sits there long enough is just going to corrode. And then you get this really sick gallbladder. So.
Soggy crouton.
Yeah.
Okay, the portal triad again. Here's your IVC, your aorta, there's a gallbladder, there's your liver. You will need to know what this looks like and what things are. Therefore, you have these beautiful images. Your turn. Label, ABC. Draw it and label it out. You can play with Play-Doh, by the way. You can build stuff for us. He's bored. I'm sure he is so bored. You can go take a nap.
There's all those
You
beds.
can close the curtain too. You can be like snoozing back there. Alright, what is A?
Should be C.
Common bile duct. What is B?
Should be H.
Hepatic artery. What is C? Portal vein. Who can tell me what creates the portal vein? Raise your hand before I pick on Angela. Oh, it doesn't suck that I remember the name. Oh, that was.
What creates the portal vein?
So, what creates the portal vein?
So is that
Or
the
the main portal vein?
so that's the splenic vein and then the superior mesenteric vein?
Mm-hmm. And what else is part of that?
The inferior.
The inferior, exactly. Union. Yay! All right. Awesome. Wow, you guys are way better today than you were last week, because when we got here, you guys were just like, what's happening? Where am I? Okay. So if we turn what it's gonna look like. So now we're in a sagittal plane. So common bile duct is always gonna be on top. Then you're gonna have the little tiny hepatic artery. And what happens is the hepatic arteries, which I didn't understand for a very long time, by the way. And then Shay had to explain it to me, and I went, oh, light bulb. Let me explain it to you. But it kind of drapes like a little snake around that CBD. I mean, it's not wrapping around it, but it kind of just does this. And so you're gonna only see like a tiny little circle here or there. You'll get color. If you put your Doppler on, you will not get color on the common bile duct. You'll get a little dot here, and of course your main portal vein will really light up. Okay? And so you will see this image probably on the boards, and you'll have to label it. You'll see the Mickey Mouse ears on the boards. You'll have to label it. So this is something, again, you're going to really need to know, because you're going to be doing this every single day. Anytime we scan an abdomen, or basically abdomen, all of your abdomens are going to have, and this is where you're going to measure. And you can see there's some gas here, so we can't see through gas on this image. But normally, you can get it to where it goes all the way to the head of the pancreas. We'll talk about that more today in lecture, so I'm not going to overwhelm you yet.
Hyperechogenic structure, is it ligamentum venosum?
This is not the ligamentum venosum, because this is the edge of the left liver lobe here.
Oh, just the
Yeah.
age.
Yeah, so it's basically the capsule of the liver.
Uh-huh, thank you.
Yeah.
Is that an irregular common bile duct? Is that
I don't know, because we have to measure. Did we measure? Oh, did we measure?
Oh.
So a lot of different things. I mean, if it was yours, yes, that would not be a normal common bile duct. Because it says 0.73, which means it's 7 millimeters. You guys will learn in class, I believe, Ray's class, that anything 6 and below is normal. But once they hit 60, you can add an extra millimeter to it. Yeah. Or if somebody does not have a gallbladder, then they usually have a really thick common bile duct, because they no longer have that gallbladder, and it usually goes up to 10. So it's gonna vary. Good question.
When you said that you'll be able to elongate it all the way to the pancreas under the circumstances, would that be like from the liver all the way to the
Yeah. Yeah, so what you'll do is you'll find the largest part of the common bile duct, right? And you'll measure that. And then usually when it tapers down into that pancreas, you're gonna measure the distal end. So the proximal and distal end you're gonna measure.
Oh, okay.
Yeah.
But you
And
won't
so
take
on
it in
our,
one image.
you can take it in one image if you can get it.
Oh, okay.
But usually
Yeah, usually.
normal habitus, body habitus, you gotta take 2 images to get it going into that pancreas, yeah. But it should be small going into the pancreas, right? And it'll be a little bit larger proximal, smaller distal. And on our worksheets, we do the biggest measurement to the smallest, so they always ask us, what is the measurement? And if you can't get the distal, you have to write in, unable to see distal. If you can't see it, then no harm, right? The problem is if you can see it, and it's large. Being large is not. All right, label, your turn. Draw and label so that you have it permanently in your brain.
For the mission, that's so when I'm doing and it's gonna be with 7 o'clock. So the point is told about that, but
Are we gonna finish our lecture today? We haven't even started today's lecture yet. This is yesterday's lecture. You're right. Yeah. She can't go.
It seems like we're late for everything. Like
Everything.
how we will get in the final exam.
I don't know. She'll cancel the final.
Oh, maybe it would be great. Yeah. Do we need to ask Shed to, for example, physics? We are too late. We can come other day and do one of extra physics to be.
She said that she factored in extra days,
Yeah, in the
Mhm.
so it's okay to be late in the physics.
Ah,
She has
okay.
extra days to make up.
Remember when I said you can see it? Okay, how did you guys do? What is A? Yeah, what's B? Hepatic artery. See? Main portal vein. Alright, you guys feel like you got this now? Whereas last week you, I'm done. You guys were hilarious, by the way, last week. It was quite cute. So, we do have something, this actual thing, called the double barrel shotgun sign. And, as you can see, a double barrel gun, I didn't understand this, so I put a double barrel gun so you guys can see what it looks like. Two big barrels, right? The main portal vein and the common bile duct should never be the same size. You guys got to see in the Mickey Mouse, right? Like really. So when you see them the same size, and you turn on them right here, and obviously you don't even see a hepatic artery in this image because the common bile duct is so large. But we'll call that a double barrel shotgun sign, and that is just not good news. Yeah, and you'll learn in your pathology class. But for now, just know that if you get this image, figured out why they're in pain. Probably radiating to the right shoulder too. And it probably happens every time they eat a fatty meal or they have dairy. I love asking those questions because if you ask those questions ahead of time, you know exactly where you're gonna go look, right? So we both love it. All right, woo! And this is the blown up version of kind of what you guys drew and put together today. And I have it all labeled for you. So let's go through it really quick. Let's start with the gallbladder here, okay? And so this one is the right hepatic because it's going off into the right lobe. And can anybody tell me what this little thing is right here?
Fissura?
There should be a falciform ligament there. This is dividing the right to the left. Or I'll just keep asking you guys questions until everybody's
It's
loud
not
and they're like, we
falciform.
got it!
It's not
This is your
falciform.
left lobe. So then this would be your left hepatic duct. And then they come together and
Toni, sorry.
Yeah.
The ligament, because we're on posterior, right? So
Yeah.
is it
It
the-
couldn't-
we're anterior.
This
It's
is
not-
anterior? Okay.
It's not anterior.
This is an anterior image. Because this is the S and V, not the IVC.
We like up the liver, age.
And this right here is your hepatic artery coming off of the celiac tract. So
It's like
it gets confusing because if you first look at the image, you probably think one is the IVC and one's the aorta, but they're not. This is just a zoomed up version. No aorta, no IVC in this image. Okay. So you've got your left, you've got your right. Same thing with your portal, main portal vein. You've got your left here, you've got your right. And your right hepatic artery, left hepatic artery. Seeing a theme here? They all kind of go in and split because they got to pee different portions. You don't really need to know this one right here, but you definitely need to know your common bile duct and how they split, and then know your hepatic arteries, how they split, and your portal vein. So the marriage is taking place down here, so we don't even see that, right? We're literally just zoomed up on the portal triad. Oh, let's put it all together. There is, I believe, we're 3D. What the heck?
looking like from the beneath. The previous picture, it was not anterior, like from beneath.
Yeah.
Technology. So disappointed. Well, this was supposed to be your 3D liver, and it flipped around to the back and showed you the back, right? And there is a video that I attached though, because last time you guys wanted like the actual liver. So I put it on there. That is not this. It's actually a better one where you go on YouTube and he literally like breaks it down for you. Okay, and if you've got a 3D model. So I did the research for you, so you don't have to waste your precious time that you don't have anymore searching. So that is what you'll see at the bottom of that last sheet. Okay, and then this is, I don't even know how to say it, to be honest. So, but this is how they break up the lobes. I'm not even going to attempt unless anybody knows how to pronounce this dude's last name. You know, yeah. So we don't necessarily use this in ultrasound unless you get to the aspect of helping with when they do transplants. Then your job would be to look at these vessels and make sure that they're going in the right direction, make sure the flow, like making sure everything. But this is so advanced that I'm just giving this to you so you guys can look at it. It's probably one of the best images I've found because it can show you where all the vessels and everything are broken up in there. Yes, Mr. Toni?
This got me confused again. It says
Yeah.
left lobe medial, left lateral, and it's got the Hepatic Artery, Falciform Ligament.
Oh.
The left lobe medial.
So this is the medial aspect because look at, what is this,
Yeah.
what is this called? This little
That's the Falciform.
Yes, falciform ligament. So the falciform divides the left from the right. But this medial aspect, if you turned it to the back, what two lobes are you going to see? Yeah, exactly. And so they call it the medial. Don't worry, medical things try to confuse you so much, okay? But, and you can also look at pictures that like will confuse you because they're not anatomically correct. So I try to find the right ones. But for this, I mean, you just don't study this. You don't need it. You're not going to be quizzed on it. You're not going to be tested on it. This is very advanced. This is just to help you understand that in the medical field, they chop up the liver into different pieces, basically, to figure out when they're doing transplants. And as you guys know, you can chop off if it's a healthy, if you have healthy tissue, it has to be healthy tissue. But they can chop off 90% of your liver and it will grow back. You only need 10% of your liver to grow back. But that is only if it's healthy. Yes.
Will this be on boards?
What was what?
Will this be on the board?
Will this be our registry?
Oh, no. That's why I was like, don't even stress about it. Yeah. I never got one question. I don't even think it's in like Petty's book. I mean, maybe it is, but no. This is totally advanced stuff. And I think if you guys did vascular, you know, then it would probably show up. But and then here you go. Here is the posterior and the anterior view. Broken up. Someday you may use it. But we have bigger fish to fry in ultrasound. Right? So don't waste your time studying that. Alright, so left liver lobe. You're going to learn this in lab, your other labs, but I just want to show you really quick. Here's your transverse, and we always say left liver lobe, so LLL, transverse. So this is the 3 different spots where you're going to take your image. I just want to give you guys a visual before you start your liver lab, because this is what she's going to teach you, okay? So that's what it's going to look like. Here's your sagittal for this is just left lobe, and you're going to cut it into those slices. So basically, you know, boom, 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 boom. And you have to, you guys, she'll teach you, because this is really isn't the class for it, but you have to go all the way out, because all the hairy scaries are typically like hanging off the edge. right? And so if you don't scan all the way out, and when you come back and you take this slice, you're telling the radiologist, I looked all the ways out here and there's nothing. Here's a representative image. Okay? Because you're just slicing this as representative images, saying there's no interhepatic problems, there's no cysts, there's no masses, and here are my 3 images. I promise I looked, I went all the way out, right? So, yeah. Look at your little pop over there. Alright, ultrasound images. Alright, let's see if you guys have been scanning, and if you guys can answer the question. The first image, I want you to think about it. Are we in a transverse plane or are we in a sagittal?
Sagittal.
Sagittal. Why? Can anybody tell me why and how you figured that out?
The IVC.
Yeah, the IVC is in a long, right? We chopped it up. So yeah, absolutely. See what that CVD is? See how tiny it is? It's coming right out of that liver. And that's the portal vein. You guys see how tiny this hepatic artery is right there? Yeah. And this is a hepatic vein. How do you figure out what hepatic vein it is though?
Where you're at.
Yeah, you're in the left lobe of the liver here, right? And so this is obviously going to be your left. It took me a long time for all this stuff to click, by the way. So still, if you're not getting it, it's okay. I'm just going to say it over and over and over until someday it clicks. Okay.
Something fell off.
This one, is this transverse or is this sagittal? It is transverse. The gallbladder just happens to be flopped in a sagittal position, but that is not the star of the show. The star of the show is your Mickey Mouse sign. So, what is this here again?
Covered bile duct.
What is this one?
Hepatic artery.
And of course, what this is?
Portal
Portal
vein.
vein. You got it. And then see that here's the neck of the gallbladder. Yeah. And there's a fissure right here, small, but between the gallbladder and the portal vein. Does anybody remember what that is?
MLF.
What?
MLF.
Yeah, main lower fissure. Yes. Who said that? That was such a quiet little tiny voice. Oh, okay. All right, that makes sense because it's way, way, way on that. Okay. Let's do this one. The first one is this. This is the hepatic veins. You see there's a left, there's a right, and a mid. And is this transverse or sag?
Transverse.
Transverse. You got it. How about the aorta here? Sagittal. And can anybody tell me what this is right here? Yes. How about this guy? Yeah, celiac trunk. Sometimes you'll see it go this way, sometimes you'll see this, sometimes, yeah, you're not always gonna get a perfect image like this. But remember, you wanna go as proximal as you can. So this is where you're gonna measure your proximal. Your mid, you're gonna actually go down a little bit further, anywhere after your celiac trunk. Which I think you guys are all looking at. Alright, let's have some fun. Describe
didn't
the
catch
massive sonographic current
Okay,
and
sorry.
location in the liver. This might be a little tough. We're gonna stretch your minds a little bit. I already labeled it for you, so you kind of know that we're in the right lobe at the first one. So, how would you describe the border? Yes, well circumscribed or smooth borders, however you want to say it. What is the echogenicity? Hyperechoic, yes. Would you say echogenic?
Yeah.
No, because echogenic is really for something that's calcified. This isn't calcified. By the way, that could be a lot of different things, but that is what a hemangioma looks like, but they're tiny. They're really small. Yeah. That, questionable what that could be. Now, is it vascular?
We don't know.
We don't know, because there's no color on it. If it was vascular, is that good news or bad news? Best, yeah. Because it's got a feeder vessel, right? Yeah. Does it look homogeneous or heterogeneous? I use the word mostly homogeneous, right? Perfect. And that is in the right liver lobe. This is just to give you guys the basic here. All right, let's look at the other one. I gave it away, right liver lobe. This is a sagittal. How do we know it's sagittal? Can anybody tell me? This is advanced, so you're not supposed to know this.
Kidney
The
inside.
kidney. The
Inside.
kidney is in a sagittal position, so yes, that's how I figured it out, right? Yeah. And that's just another slice. Now, how about this one? What are the borders like on this one?
Irregular.
Very irregular. Yeah, very irregular. See the difference? Irregular versus smooth. Irregular, is that good news or bad news? Bad news. Yeah. And what's the echogenicity?
Hyper.
Hyperechoic. And again, mostly homogeneous. Yeah,
Homogeneous.
good job. Ooh. Right liver lobe, the first one here, again. How do we describe this? Does anyone want to be brave?
Multiple.
Multiple. What else?
Around.
What was it?
Around.
Yeah, multiple round structures or lesions or neoplasm, whatever verbiage you want to say.
Is it hyper or isa?
Yeah, I would definitely say hyper because we
Hyper.
can see it, right?
Uh-huh.
Yeah. Smooth borders, but does it matter when there's multiple? There's something multiple in the liver. It's most likely meds.
It's
So,
most
never
likely
really a good thing.
metastasis. Oh,
Peter doesn't
metastasis.
know. And meds can look a lot of different ways, right? Yeah, you guys understand meds metastasize, right?
Metastasize.
All right, how about this image? Yep, hypoechoic. I would say that there's pretty smooth borders.
What about the fact that it's big? How would I?
Yeah, they're not infiltrating though. They're not like little claws, right? And so that's how I decide. I'm like, it's still a smooth wall, even though, I mean, compared to that one. So if you know 100%, you're like, yeah, irregular borders, then you're right. If you're not sure, it's probably still smooth borders.
So ill-defined just means irregular. It doesn't really.
Yeah.
It doesn't really artificial.
Right, exactly. Ill-defined is a really good terminology to use. This, by the way, is close to that portal vein. What sits next to the portal vein?
Pancreas.
Pancreas, gallbladder. This is mainly where you're going to see what we call, when somebody has a fatty liver, sometimes the liver will compensate and be like, okay, well, all of you can be fatty, but this one section or this one area. And so this is like the fatty infiltration. It's just basically giving you a sign that, look, this is a fatty liver. And we've got some fat hanging out. Because that's usually where it starts.
What is it? What did you say here?
What
What did you say?
It's usually just fatty liver. Yeah.
Fatty liver around and its normal part. Is it
Yes.
true?
Yes, sometimes. So it all varies.
Mm-hmm.
And Shay will teach you guys this. So this is your first time looking at it. That's why I'm not going to overdo it for you because I don't want you to memorize this. This is just gives off notes of the fatty liver. So that's just a little, we call it sparing. I think that's what it's called, fatty liver sparing. That's the part of the liver that has been spared. The rest is all fat. Yes. My liver looked like that once upon a time. And again, if you do the experiment of drinking heavy one night, you never know what your liver could look like. You might have some sparing. Yeah. Okay. Right liver lobe. Here's another one. What is this most likely?
Unechogenic.
Most likely some kind of cyst. So how would wanna say it? Yes.
You would say posterior enhancement because it's brighter.
Enhancement.
Yes, yes, exactly. Posterior enhancement, you got it. Woo, what about this one? Looks like someone took a bite out of the liver and left their teeth. So because it's calcified, we can say what? Echogenic, yeah, multiple echogenic areas with posterior shadowing. There we go. Yeah. Perfect. Okay. Again, I want you guys to kind of test yourself and see where you're at. And again, I made this so that you guys have it. You can test yourself at home over and over and over. Yes, read.
No, I'm fine myself.
Okay. That's all right. Yeah. If I told you not to worry about one, don't worry about it. Oh yeah, that one. Yeah, that one. Don't worry about that one. Just put a smiley face there, like, ha! I didn't have to know you. I'll change that for next year.
No.
Dang it. Trick question. No, I'm not here for you.
Maybe she's not intending on doing that.
Maybe.
But she posted it.
What's the first arrow?
Bile duct.
The common bile duct, right? Common bile duct. What's the second arrow? Main portal vein. Third arrow.
That's what we're looking at.
Yeah. Smiley face. You guys don't really need what is the fourth one?
Proper
Hepatic artery. You guys are learning stuff. And what's the last one? Celiac trunk.
Electronic.
And what is 3?
Common bile duct.
CBD. What is 2? And what is 1? Now put it in a different order, but I asked you in the same order because I want you guys to remember it in one order, but be able to answer it in a different order. Okay. And this is just for you to practice at home. We don't have to do it now. But yeah, you need to quiz yourself. There you go. Okay, so I'm gonna exit out of this and we're gonna open up our PowerPoint. You guys wanna take a minute to stand up, stretch,
yes, please.
water, yeah? There you go.